Hey there. Have you ever caught yourself rubbing your eyes because they feel dry, gritty, or just plain uncomfortable? You're not alone. Here's a surprising fact. Over 16 million adults in the US deal with chronic dry eye syndrome, and millions more worldwide face the same struggle. It's not just a minor inconvenience. It can affect how you work, how you sleep, and even how you enjoy your day. So what's causing it? And more importantly, what can you do to fix it? That's exactly what we're diving into today. We're breaking down the 7 most common causes of dry eyes and sharing practical at-home treatments to bring you real relief. Stick with me, you don't want to miss this. Alright, let's start by understanding what dry eyes really are. It's not just about your eyes feeling dry occasionally. It's a condition that happens when your eyes can't produce enough tears, or when the tears they do produce evaporate too quickly. And here's the thing, your tears aren't just water. They're made up of 3 layers, a watery layer, an oily layer, and a mucus layer. And each one plays a critical role in keeping your eyes hydrated and comfortable. When something disrupts this delicate balance, you start to experience the classic symptoms: dryness, redness, irritation, or that gritty sensation like there's sand in your eyes. If this sounds familiar, it's time to take a closer look at what's causing it so we can find the right solution for you. Now, let's talk about the first major cause of dry eyes: medical factors. These are some of the most common and often overlooked reasons why your eyes might be feeling dry. First up, aging. As we get older, especially after the age of 50, our bodies naturally produce fewer tears. It's a normal part of aging, but it can leave your eyes feeling dry and uncomfortable. Next, let's talk about hormonal changes. For postmenopausal women, hormonal imbalances can disrupt the production of tears, making dry eyes much more common. In fact, women are more likely than men to experience dry eyes because of this. Then, we have autoimmune diseases like Sjögren's syndrome, rheumatoid arthritis, and lupus. These conditions cause inflammation that directly affects your tear glands, making it harder for your eyes to stay lubricated. But that's not all. Certain medications can also be culprits. Antihistamines for allergies, decongestants, beta blockers for blood pressure, diuretics, antidepressants, and even hormone replacement therapy can reduce your tear production and make your symptoms worse. And let's not forget other medical issues. Conditions like blepharitis and meibomian gland dysfunction can block the oil glands in your eyelids, leading to faster tear evaporation. Diabetes, thyroid disorders, and even vitamin A deficiency. All of these can play a role in drying out your eyes. Finally, there's corneal nerve damage. If you've had eye surgeries like LASIK or cataract procedures, or if you're dealing with neurological conditions like Bell's palsy, these can disrupt the nerves that signal your eyes to produce tears. So if any of these sound familiar, your dry eyes might be linked to a medical cause. The good news? Once you identify the underlying issue, there are ways to address it, and we'll talk about some practical solutions later in the video. Now let's move on to the second major cause of dry eyes: environmental factors. You might not realize it, but the world around you can have a huge impact on your eye health. Think about it. If you live in a dry or windy climate, or if you're constantly exposed to air conditioning or heating, the moisture in your eyes can evaporate faster than your body can replace it. And let's not forget pollution and dust. These irritants can trigger inflammation in your eyes, making dryness even worse. Then there's screen time, and this one's a biggie. When you're staring at a computer, phone, or tablet for long periods, you blink less often. Blinking is how your eyes naturally spread tears across the surface. So fewer blinks mean your eyes stay exposed for longer, leading to, you guessed it, dryness. Environmental factors might feel hard to control, but don't worry, I'll share some easy tips later to help protect your eyes, no matter where you live or work. Alright, let's talk about the third major cause of dry eyes: lifestyle factors. These are habits and choices that might seem small, but can have a big impact on your eye health. One of the most common culprits is contact lens use. If you wear contact lenses for long hours, they can disrupt your tear film and irritate the surface of your eyes. It's no wonder that many contact lens wearers experience dry eyes. Another big factor is smoking. Tobacco smoke is not just harmful to your lungs, it also irritates your eyes, making dryness and discomfort worse. Even secondhand smoke can have a similar effect. Then there's your diet. If your meals lack omega-3 fatty acids, found in foods like salmon, flaxseed, and walnuts, it can reduce the quality of your tears. Omega-3s play a vital role in keeping your eyes hydrated and healthy. And lastly, let's not forget about hydration. If you're not drinking enough water, your body simply can't produce the tears it needs. Dehydration doesn't just affect your skin or energy levels, it directly impacts your eyes too. Now, to the fourth cause of dry eyes, anatomical and functional issues. These are physical factors that affect how your eyes produce and maintain tears. One common issue is eyelid problems. If your eyelids don't close fully when you blink, a condition called lagophthalmos, or if they're misaligned, like an entropion or ectropion, your tears can evaporate more quickly, leaving your eyes dry and exposed. Another factor is reduced tear production, which can happen as a result of aging or damage to the lacrimal glands. These glands are responsible for producing the watery component of your tears, so when they're not working properly, your eyes can't stay lubricated. And finally, there's increased tear evaporation, often linked to low oil content in the tear film. The meibomian glands in your eyelids are supposed to release oils to slow down evaporation, but when these glands aren't functioning well, your tears disappear faster than they should. These anatomical and functional issues can sometimes feel out of your control, but there are treatments and techniques to address them. Stick around, and I'll share some tips that can help. Next is the fifth cause of dry eyes, external factors. These are outside influences that can directly irritate your eyes or disrupt your tear production. One common culprit is allergies. When your eyes react to allergens like pollen, pet dander, or dust, they become inflamed, and your tear film can become unstable. This leads to that annoying combination of itchiness and dryness. Then there's eye surgery, such as LASIK or cataract procedures. While these are often life-changing for vision improvement, they can temporarily or even permanently reduce tear production by affecting the nerves in your eyes. Infections like chronic conjunctivitis or keratitis can also irritate the surface of your eyes, disrupting tear production and stability. And surprisingly, even eye drops, specifically those with preservatives, can be problematic. If used over long periods, these preservatives can irritate your eyes and make dryness worse. Now let's explore the sixth category of dry eye causes, rare conditions. These might not affect everyone, but for those who experience them, they can be life-altering. One of these conditions is Stevens-Johnson syndrome, a severe disorder affecting the skin and mucous membranes, including the eyes. It can lead to chronic dryness and significant discomfort. Another is graft versus host disease, GVHD, which can occur after a bone marrow transplant. It often damages the tear glands and disrupts tear production. Then there's radiation therapy, especially when it involves the eyes or the head and neck area. Radiation can affect the delicate tissues around the eyes, leading to dryness. And lastly, neurological disorders like Parkinson's disease can reduce the natural blinking reflex, causing the tear film to evaporate faster and leaving the eyes dry and exposed. While these causes are less common, they highlight how dry eyes can stem from a wide range of health issues. If any of these apply to you, it's especially important to work closely with an eye care specialist to find the best solutions. Finally, let's look at the seventh cause of dry eyes, psychological and behavioral factors. These are often overlooked but can significantly impact your eye health. Let's start with stress. Chronic stress doesn't just affect your mental well-being. It can also reduce tear production by disrupting the body's natural balance. If you're constantly feeling stressed or anxious, your eyes might be paying the price. Then there's behavioral habits. For example, spending long hours in front of a fan, sitting near air vents, or being exposed to direct airflow can dry out your eyes without you even realizing it. These factors might not seem like obvious causes of dry eyes, but they play a major role for many people. The good news is that simple adjustments to your daily habits can make a big difference, and I'll show you how in just a moment. Now that we've covered the causes of dry eyes, let's talk about what you can do to find relief, starting right at home. These treatments are simple, practical, and can make a big difference in how your eyes feel. First, staying hydrated is one of the easiest yet most effective ways to combat dry eyes. When your body is dehydrated, it can't produce enough tears to keep your eyes lubricated. Aim to drink plenty of water throughout the day, at least 8 glasses, to ensure your tear glands have the moisture they need to function properly. Another great remedy is using warm compresses. Applying a warm, damp cloth to your eyelids helps unblock the meibomian glands, which produce the oils needed to stabilize your tear film. This reduces evaporation and keeps your eyes hydrated for longer. You can do this daily for just a few minutes, and it can provide quick relief. Your diet also plays a crucial role in managing dry eyes. Omega-3 fatty acids, found in foods like salmon, flax seeds, and walnuts, are essential for tear production and overall eye health. If you're not getting enough omega-3s through your meals, consider a high-quality supplement. Just make sure to choose the triglyceride form for better absorption and fewer side effects. If you spend long hours in front of screens, practicing good blinking habits can help. Staring at a computer or phone often reduces your blink rate, which allows your eyes to dry out. Take regular breaks using the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. During these breaks, practice fully closing your eyes when you blink to evenly distribute your tear film. Finally, if you live in a dry or air-conditioned environment, adding a humidifier to your space can be a game changer. A humidifier increases the moisture in the air, which helps prevent your tears from evaporating too quickly. This is especially helpful during the winter months or if you spend time in places with low humidity. These simple, at-home treatments can go a long way in managing dry eyes. But remember, if your symptoms persist or become severe, it's always a good idea to consult with an eye care professional for personalized advice. Dry eyes can be a frustrating and even painful condition, but understanding the causes and taking simple steps to manage them can bring real relief. From staying hydrated and adding omega-3s to your diet to using warm compresses and improving your blinking habits, there are plenty of practical ways to protect your eyes and improve your comfort. And remember, while these at-home treatments are effective for many, some causes of dry eyes may require professional care. So don't hesitate to reach out to an eye specialist if your symptoms persist. If you found this video helpful, please give it a thumbs up and share it with someone who might be struggling with dry eyes. It could make a big difference for them. And if you're interested in learning more tips about eye health and vision care, hit that subscribe button and turn on notifications so you don't miss out on our future videos. Thank you for watching, and let's keep your eyes healthy and happy.